Have you ever felt frustrated by waking up several times during the night to use the bathroom only to feel like your bladder never completely empties? It's more than just an inconvenience. It can interfere with your sleep and leave you feeling exhausted the next day. I'm Dr. Aiko, and today I'm going to share a simple 2-minute bedtime routine that may help you empty your bladder more effectively before going to sleep. I'll show you a positioning technique that's rarely discussed during routine appointments but may help reduce nighttime trips to the bathroom and improve your sleep quality. If you're tired of interrupted nights and want to wake up feeling truly refreshed, keep watching. Many people assume that waking up at night to urinate is simply a normal part of aging or the result of drinking too much water before bed. But in many cases, there's more to the story. One possible factor is post-void residual urine, which means a small amount of urine remains in the bladder after urination. This can happen for several reasons, including weakened bladder muscles, an enlarged prostate, pelvic floor dysfunction, or certain medical conditions. One common mistake is trying to force the urine out by straining. Excessive straining may actually make it harder for the pelvic floor muscles to relax completely, reducing the efficiency of bladder emptying. When the bladder doesn't empty well, it may signal the brain to wake you again later in the night. The first step in this 2-minute routine begins with your posture. When sitting on the toilet, many people naturally keep their back straight. Instead, try leaning your upper body slightly forward with your elbows resting comfortably on your knees. This position may help relax the pelvic floor muscles and create a more favorable angle for urination. The goal isn't to force the urine out, but to allow your body to empty the bladder as naturally and comfortably as possible. Now here's a technique that many people have never heard of: double voiding. After you finish urinating, don't stand up immediately. Stay seated for about 20 to 30 seconds, remaining relaxed. Then try urinating one more time without straining. This technique gives your bladder a chance to release any urine that may have remained after the first attempt. For people who experience incomplete bladder emptying, double voiding may help reduce residual urine and decrease the need for nighttime bathroom visits. While you're waiting during those 20 to 30 seconds, you can also try making very gentle pelvic movements. Slowly rock your hips forward and backward or make small circular motions with your pelvis while remaining seated. These subtle movements may help change the position of any remaining urine within the bladder, making it easier to empty completely during the second attempt. It's a simple mechanical technique that some people find surprisingly effective. The fourth step focuses on relaxation through breathing. Sometimes, the anxiety of trying to empty your bladder quickly causes you to tighten your pelvic floor muscles without realizing it. Instead, take a slow, deep breath in through your nose, allowing your abdomen to expand, and then exhale gently through your mouth as if you're blowing out a candle. This type of diaphragmatic breathing helps activate the body's relaxation response, allowing the pelvic floor muscles to release naturally. A relaxed body is far more likely to empty the bladder efficiently than one that's tense and under stress. One valuable tip that isn't discussed very often is what you do 30 minutes before your final trip to the bathroom. If your legs or ankles tend to swell by the end of the day, some of that fluid can shift back into your bloodstream. Once you lie down, eventually increasing urine production overnight. One strategy that may help is lying on a couch or bed with your legs elevated above the level of your heart for about 15 to 20 minutes before bedtime. This position encourages fluid to move back into circulation while you're still awake, allowing your kidneys to process some of it before you go to sleep. As a result, you may be able to empty more of your bladder before bedtime rather than during the middle of the night. To complete your bedtime routine, it's also important to pay attention to what may irritate your bladder. During the last 2 hours before bed, try to avoid large amounts of fluids as well as common bladder irritants such as caffeine, alcohol, and for some people, artificial sweeteners. These substances can increase urine production or make the bladder more sensitive, creating the urge to urinate even when it isn't completely full. If you become thirsty, sip small amounts of water instead of drinking a large glass all at once. These simple adjustments can help support a more restful night's sleep. If you've made it this far, I'd like to share what I often consider one of the most helpful concepts in my practice. Sometimes the issue isn't your bladder itself, it's where your body stores fluid throughout the day. Have you ever noticed mild swelling in your feet or ankles by late afternoon? That's fluid that has accumulated in your lower legs due to gravity. Once you lie down at night, that fluid gradually returns to your bloodstream, where your kidneys filter it into urine. That's one reason some people find themselves waking up several times to use the bathroom even if they stopped drinking fluids hours earlier. To help reduce this effect, try a simple pre-bed fluid redistribution routine. About 30 minutes before your final bathroom visit, lie down with your legs elevated above your heart using pillows for support. Stay in that position for about 15 to 20 minutes. This allows excess fluid from your legs to move back into circulation while you're still awake. Afterward, empty your bladder before going to bed. Many people find this simple habit helps reduce nighttime urination, particularly if leg swelling is part of the problem. While your legs are elevated, you may also find it relaxing to gently massage the inside of your ankles or your lower legs. Although massage can promote relaxation and temporarily improve comfort, it's important to know that there is no strong scientific evidence that pressing specific reflex points directly improves bladder function or reduces urinary urgency. However, the calming effect of gentle massage and relaxation techniques may help reduce muscle tension and prepare your body for sleep. Another factor that can influence nighttime urination is the amount of sodium you consume at dinner. Salty foods encourage your body to retain more water, which can later be eliminated during the night. Processed foods, restaurant meals, and heavily seasoned dishes are common sources of hidden sodium. Reducing salt intake in your evening meal may help decrease nighttime urine production in some people, especially when combined with other healthy bedtime habits. Finally, don't overlook something as simple as keeping your feet warm. Some people notice that exposure to cold temperatures seems to increase the urge to urinate, partly because cold can stimulate changes in circulation and bladder activity. After completing your bedtime routine, consider wearing comfortable socks if your feet tend to get cold. Staying warm and comfortable helps your body relax, creating an environment that's more supportive of uninterrupted sleep. Small details like these may seem insignificant, but together they can make a meaningful difference for people living with an overactive or sensitive bladder. To further support relaxation before bedtime, consider talking with your healthcare provider about whether magnesium is appropriate for you. Magnesium is an essential mineral involved in muscle function, nerve signaling, and sleep regulation. For people who have a magnesium deficiency, correcting that deficiency may help support normal muscle relaxation and overall sleep quality. However, magnesium is not a proven treatment for overactive bladder or nocturia, so it's important to discuss supplementation with your doctor, especially if you have kidney disease or take medications that may interact with it. Combining healthy bedtime habits with appropriate medical guidance gives you the best chance of improving your sleep. The strategies we've covered today aren't quick fixes. They're practical tools that can help you take a more active role in your health. Too many people accept poor sleep and nighttime bathroom trips as an unavoidable part of aging, but that isn't always the case. By combining leg elevation, mindful fluid intake, reducing sodium at dinner, keeping your feet warm, and practicing proper bladder emptying techniques, you may be able to improve your sleep and reduce unnecessary nighttime awakenings. The key is consistency. Small changes practiced every evening often produce the greatest long-term results. Let's quickly review the routine. Your 2-minute bedtime ritual isn't simply about urinating, it's about working with your body's anatomy instead of against it. Leaning forward while sitting on the toilet, practicing double voiding, and using slow diaphragmatic breathing may help some people empty their bladder more effectively. Pair that with elevating your legs before bed if you experience leg swelling, and you've created a practical bedtime routine that supports better bladder emptying and healthier sleep. Remember, your body learns through repetition. The more consistently you practice healthy habits, the more likely they are to become effective over time. I encourage you to give this routine a fair trial for 7 days. During the first couple of nights, you may not notice dramatic changes, but many people find that consistent bedtime habits become more effective after several days. Keep track of how often you wake up at night, how rested you feel in the morning, and whether your sleep quality improves. If you'd like, leave a comment below sharing your experience. Your progress may encourage someone else who's struggling with the same problem. Now, imagine what uninterrupted sleep could mean for your daily life. Better rest often leads to improved mood, sharper concentration, more patience, and greater energy throughout the day. Chronic sleep disruption from nocturia can affect every aspect of your well-being, but improving your sleep habits may help you regain the energy and quality of life you've been missing. You don't have to accept waking up exhausted as an inevitable part of getting older. Learning how your body works is one of the most valuable investments you can make in your long-term health. As a physician, I also want to emphasize that while these techniques can be helpful for many people, they are not a substitute for medical evaluation. If you continue experiencing frequent nighttime urination despite trying these strategies, or if you notice blood in your urine, severe pain, fever, burning during urination, unexplained weight loss, or significant swelling, please schedule an appointment with your healthcare provider or a urologist. Conditions such as urinary tract infections, uncontrolled diabetes, enlarged prostate, bladder disorders, heart disease, or kidney disease require proper diagnosis and treatment. Think of this routine as one part of a comprehensive approach to protecting your health. If you found this information helpful, don't keep it to yourself. Many people struggle with interrupted sleep without realizing there are simple habits that may help. Click the like button so more people can discover this video, subscribe to the channel for more evidence-based health tips, and share it with your family and friends. Thank you for allowing me to be part of your journey toward better sleep and better health. I look forward to seeing you in the next video. Sleep well and have a peaceful night.